welcome back to Good Morning Arkansas. We're joined now by Dr. John Terrell, who's with Arkansas Urology, to talk about something that is very important to the men in Arkansas. Well, actually men across the country, but we're targeting men in Arkansas. You're with Arkansas Urology, but you guys are partnering with St. Vincent for a very important event. Let's talk about that.
Yes, ma'am. Well, September is Prostate Cancer Awareness Month. Prostate cancer is the second most common cause of death, cancer death in men in the United States. Other than skin cancers, it's the most common diagnosed solid cancer in men in the United States. In Arkansas, in 2010 alone, roughly 2,500 men were diagnosed with prostate cancer, and unfortunately, close to 400, or a little over 450 of those men died of prostate cancer. The key to prostate cancer is early detection and screening for prostate cancer, both with a PSA and a digital rectal exam. So on September the 15th, with partnership with St. Vincent's at Arkansas Urology, over on the Arkansas Urology in the West Campus, the main campus off of Canis and Centerview Drive, we're going to be offering free prostate cancer screening for men that qualify.
And let's talk about those who qualify.
Okay, the main men that qualify are men that are over the age of 40 years old and primarily have never had a prostate exam before. And generally the two components of a prostate exam are a digital rectal exam to fill the prostate, and also a laboratory value called PSA, or a PSA check.
Well, let's talk about that for a moment, if you don't mind, Dr. Terrell, because those kinds of things probably sound kind of scary for some men who have never done it before. What do you tell them?
It is, but most of the men that come in, they find that they start off, a little anxious for the exam. We give them a little descriptor of what's going to happen, during the exam. Also, we let them know that we're going to need to draw their blood and send off, and that both of the components by themselves, though, can diagnose prostate cancer. It's looking at them together. It provides us with the clearest picture of their prostate cancer risk. And then we talk to them about how the actual exam is, and the actual exam is less than around 10 seconds, and most men tolerate it well, and they usually get it on a yearly basis. So usually it's that initial exam that they don't know what to expect, but there's no reason for them to be nervous at all, and most men find that, oh wow, I didn't expect for it to be, that's all there was to it.
Yeah, so I imagine it is, as you said, the fear of the unknown, but obviously we want to be able to detect it as early as possible, although prostate cancer might not be preventable itself. Death is preventable if it's treated or caught in time.
Exactly. There's been some trials that tried to prevent prostate cancer, and so right now there's not a real good consensus on prevention of prostate cancer. However, the best way to survive prostate cancer, if you develop it, is early detection, and that's why we're doing this screening in combination with St. Vincent's and offering it to men during Prostate Cancer Awareness Month. This kickoff to men's health it's the 7th annual kickoff to men's health that we're going to be having, and it will be, like I said, over on the West Campus at Arkansas Urology. They will help try to detect prostate cancer early in men, and to provide them with the best chance of survival and good quality of life.
So 40 and older is the target age that
yes, ma'am. 40 and older, and primarily men that have never had any kind of exam before at all.
Okay, and we want to remind, because sometimes, we talk about women putting their health on the back burner. Men, probably more so than women, don't go and take care of those kinds of things. So we want to really encourage men to get out and get those prostate screenings, don't we?
We do, and another important thing about prostate cancer is a large majority of the patients with prostate cancer that are detected currently have no symptoms. So they're walking around not knowing that they have prostate cancer. Some of the men have some urinary symptoms, such as a decreased urinary stream, but that also can be seen in benign prostate enlargement that all men undergo, so it's hard to tell the difference between the two. So a lot of men, screening is the only way that we detect their prostate cancer early enough to prevent death or metastatic prostate cancer is by detecting it early through screening and then being able to provide the appropriate treatment that they choose prior to it developing into metastatic prostate cancer.
And so for the women at home watching this, we can encourage them to encourage their husbands or significant others to go and take care of that.
They should. And in addition, men that have never had their exam before and also are having urinary symptoms, that's another key indicator. I would, men that have urinary symptoms always would have to be ruled out for prostate cancer as well. So though the majority are without symptoms, there are some that have some urinary symptoms. So I would encourage the wives and women in men's lives to get them to come down on September 15th between 5 and 8 for this free prostate cancer screening.
Awesome. And then there's a website for more information. It's arkansasurology.com.
Yes, ma'am. They can go to arkansasurology.com, and if they would like to set up their free prostate cancer screening with Arkansas Urology, they should call 501-219-8900, and they can leave the information and get set up for their free prostate cancer screening. It's on a first-come, first-served basis, and it's on the 15th between 5 and 8.
Right.
And more information will be available on the website at arkansasurology.com.
Well, thank you so much, Dr. Terrell. And we're reminding women, for the men in your lives, take them to the doctor. All right.